The primary objective of this project was to install digital medical devices at several rural health clinics in Gjakova municipality for the purpose of serving remote, underprivileged communities with the greatest difficulties of getting to main medical center and hospital. We have put in place innovative wireless technology capable of conducting patient exams and transmitting data in real time between a main family medical center and the clinic. This will continue to help preempt serious illness through early intervention. A secondary objective was to train health clinic staff in telemedicine techniques and make available a medical electronic library maintained by the Telemedicine Center of Kosova, so that quality healthcare is sustained for generations. Area of focus of this Rotary Project was disease prevention and treatment. The introduction of telemedicine technology will allow the patient, clinic nurse and the family medical center specialist to view in real time the results of an examination. Telemedicine will bring a doctor's expertise in real time to provide diagnostic services and suggested treatment, and without the need for village patients to leave their community. This project was requested by the community of Gjakova to improve healthcare to their rural citizens. Gjakova municipality, it counts a population of 100,000 inhabitants, which will enjoy residual benefits as doctors gain more time through telemedicine efficiencies and are better able to serve the population as a whole. Furthermore, this Rotary Project is part of the Republic of Kosova's government's policy to maximize efforts to improve medical service to the less affluent citizens of Kosovo. Nothing assures a successful project more than a solid desire on the part of the stakeholders, including the local government, to improve the livelihood of its community. During the project implementation, we applied a direct telemedicine technology, training for staff of all family medical centers of the municipality of Gjakova. 37 doctors have been trained, as well as the operating staff of the telemedicine hub. The training was tailored to the participating clinic staff to better understand the new technology, improving the capacities of local healthcare professionals, enhancing the health infrastructure of local communities by the application of the telemedicine. We would like to thank our implementing partner, Edwards Club, District 5470, and all the contributing clubs and other districts for the support provided. In the name of Rotary Club Gjakova-Qabrati and in the name of the community of Gjakova municipality, I would like to thank you from the bottom of our hearts.
Faleminderit Butrend për iniciativën, posaçërisht Rotary Gjakova-Qabrati i cili ka bërë të mundshme furnizimin me këto pajisje, që ndoshta është edhe fjala e fundit e teknologjisë. Gjithashtu falenderojmë edhe të nderuar Richardin, i cili është edhe pjesë e kësaj ekipe me siguri që ka qenë edhe një shtytje mjaft e madhe që u bë furnizimi apo pajisja e qendrës kryesore të mjekësisë familjare me një teknologji që besoj që edhe popullata do të ketë më lehtë, do të ketë shërbime më cilësore, ndërsa për stafin mjekësor shpresoj që do të jetë një çështje më lehtë në diagnostifike, ashtu që janë destinuar që me qenë edhe në skajt të komunës, në vendet rurale, ku qasja është më e vështirë pacientave në qendrën kryesore të mjekësisë familjare. Shpresoj që bashkëpunimi s'ka me mungu, gjithashtu ne do ta vazhdojmë edhe ta shëtutje që kontributi të jetë reciprok.
It is with greatest pleasure that I am here in behalf of the International Club of Edwards Rotary Club to work with the Rotary Club of Gjakova-Qabrati and bring through our joint efforts a new technology for this region of telemedicine. We believe that it will save time and money by individuals from distance being able to send images and voice to their physician without leaving their area. We really welcome the opportunity to work with you and all of the staff, medical staff here in this municipality. I thank you for your willingness to be one of the first in the country to try this new medical procedure.
Thank you.
Thank you very much.
We have managed to establish this one and to implement really this project. Actually now we see what we have in our hands, and we have undergone through the training, and I believe it will be very useful for our patient and also for the medical staff to advance further our competences in providing medical care. Congratulations.
Thank you. Thank you.
TeleMedicine and teleradiology company in San Francisco. We're all over the world, and we work mostly. Then went into IT. He was already in IT in the Navy, but medical IT, and he actually installed MedWeb on many ships for doctors and nurses and any person in healthcare. So this lens is for skin. So this is like a very, very good ophthalmoscope, very expensive ophthalmoscope.
Good.
To have the person look straight over at your shoulder, and you're approaching from 15 degrees out. Okay, so he's looking over my shoulder, and you come in at 15 degrees, you're able to look right into the back of the eye and see the retina. You can use the MedWeb to store these images. So when you go see the patient again, you can compare your ultrasounds and so on from the previous visits. And you can do that with the scopes, with the ultrasound, with the EKG, and also with the stethoscope. Once it's turned on and it's recording, then you'll hear perfectly in your ears, and also your colleague on the other side of the link, of the collage, can hear the heart sounds also. Doing diagnostics in the rural clinic and saving the patient. So this is the simplest and easiest thing when a patient comes in and maybe they smoke too much and you're trying to figure out if they have COPD. Well, the first things you want to know is how much oxygen is in their blood. So this is an attachment for looking here. We have one for general exam camera, just anything. This is a lens just for skin. This is an EKG machine, and it's also Bluetooth. So it connects wirelessly to the laptop, and it's just as good as the big EKG machine. We also give you these disposable lead adhesives, All right, so now I've logged in, and down here, I know this is small, so I'll just explain it to you. It gives me an option to join a conference, create a new conference, or schedule a conference. So for example, I might want to just call somebody right away, or somebody may have invited me to a conference, I could just join it. Or I might decide that you and I will have a conference, say tomorrow at 11 in the morning, because I have a patient that I'd like to share some of the findings with you, and then I schedule it. If I schedule the conference, then you get an email with a link in the email, and you click the link, and it opens up the conference at 11. So it's very, very easy, very similar to using some of the other desktop conference tools, except that it's all medical. And collaboration also with the TCK, the Kosovo TeleMedicine Center of Kosovo, and we expect to see some people from there here today as well. Many hours of having somebody sit there and go through the EKGs manually. We were just going through, we're very, very fortunate, thank you for coming, but also we have Rotary, we have the TCK crowd from Pristina, and we have these doctors from Gjakova region. Is fantastic.
And TCK from Albania.
Yeah, as you can see, the kit is just a bunch of tools that now you can use with this software. And this is the brightness. So just to get the right brightness.
Ajo që desha me thonë është vetëm mund të kemi të gjitha aparaturat më të sofistikume që ekzistojnë. Ajo që do të thonë është se këto aparatura tash janë thjeshtësuese. Esenca aty është thjesht transmetimi i një imazhi, një dhënë, një situate kudo, nga cila do pozitë ku gjendeni, në mal, në fund.
Si dhe TeleMedicine apo të klubit Rotary Qabrati, për të thënë drejtën, nuk jam hamend, sepse na jemi në botën e civilizimit, jemi në botën e shkegullnisë që e arsytojnë edhe kërkesat tona. Mirë po ku vrej që shansa më ka përfasu ma mirë shansa pozitive që pikrisht të në qyteti jonë.
So many signals that are going on.
Pajisjeve që do t'ju lejoj juve me bë disa lloj ekzaminime mjekësore.
It is the first club in Kosovo established by a group of women of the municipality of Gjakova. By the time it extended with members of both genders and want to consider it a very ambitious club and ready to serve the community at any time. Now the club is comprised of 37 active and honorary members.
Today our main topic, it will be just discussing around our project and also discussing about our experience working together with Rotary Club of Edwards. What we are proud most, it is this project that it is currently being implemented, and this is thanks to our friends from Rotary Club of Edwards, because this is one of the projects which really it is going to create, we strongly believe that it is going to create a strong impact in our community by helping improve the healthcare system in the primary sector. It is very interesting to mention that we are not implementing one project. These are two combined projects. So, project of purchasing devices for telemedicine in the rural areas, and the other project, it is a vocational training team for telemedicine. So both of these projects in order to help implement successfully telemedicine in our health system.
Both projects, the telemedicine and the breast cancer detection center, are the biggest ever Rotary projects in Kosova. So that makes us even more proud and gives us a boost to work even more in the future. So
Exchanging banners.
Yeah.
May I? This will be you.
Then.